Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 3rd, 2025. This video is on a JAMA Cardiology article titled Prevalence, Determinants, and the Time Trends of Cardiovascular Health in the WHO African Region. There's an accompanying editorial, WHO Steps and the Future of Cardiovascular Disease Prevention, published the same day. Cardiovascular disease causes 32% of global deaths, over 75% in low and middle income countries. Africa faces rising burden due to high blood pressure, obesity, smoking, poor diet, and limited health care. Study investigators use primordial prevention via Life Simple 7 AHA, that's AHA, American Heart Association framework, which includes smoking, body weight, physical activity, diet, blood pressure, cholesterol, and glucose. Life Simple 7 was chosen instead of Life's Essential 8, as sleep health and hemoglobin A1C were not measured in WHO surveys. The designed 25 WHO stepwise surveys from 2003 to 2022, population 73,024 adults from the age of 18 to 69 years, free of cardiovascular disease, representing 95 million people across 22 countries, mean age 35.4 years, around 49% were female. Analysis, multi-level models adjusted for socio-demographic and contextual factors, including education, GDP, and nutrition. Outcomes, weighted prevalence of poor 0 to 7, intermediate 8 to 11, ideal 12 to 14, cardiovascular health scores, and time trends. What did they find? Ideal cardiovascular health 26.2%, intermediate in 57.9%, and poor in 15.9%. Determinants, older age, odds ratio 0.06 for ideal. Female gender, odds ratio 0.80. Lower education, heavy alcohol intake linked to worse cardiovascular health. Contextual factors, more education and higher undernourishment linked with better cardiovascular health. Time trends 2003 to 2022. No significant improvement overall. Limitations, missing data for cholesterol and glucose, reduce the sample size. Dietary metric limited, fruits and vegetables only. No sleep health or hemoglobin A1C data. Couldn't use Life's Essential 8. Cross-sectional only, no clinical outcome follow-up. Key takeaways, only 1 in 4 adults achieved ideal cardiovascular health. Education and early life prevention are critical levers. Women had worse cardiovascular health than men, and the need for gender-focused interventions. People should strengthen WHO Hearts, Empower, and Active initiatives in Africa. The accompanying editorial says that WHO Steps, which is a stepwise approach to non-communicable disease surveillance, was launched to track risk factors consistently across countries. This study of 22 African countries, 73,024 adults, repurposed STEPS data into Life Simple 7 cardiovascular health metrics. Their findings, ideal cardiovascular health only in 26%, poor diet and physical inactivity were major drivers for poor cardiovascular health. No improvement over 2 decades. Challenges, missing or incomplete data, especially diet, cholesterol, and glucose. Lack of HIV associated cardiovascular disease analysis. Implications, positive health framing, stronger policies, and an $18 billion annual investment is needed to meet 2030 Sustainable Development Goals 3.4 targets. Steps must evolve from risk tracking to defining and delivering cardiovascular health for all. There has been no improvement over 2 decades in cardiovascular health in Africa. The key takeaway: urgent need for gender sensitive, education driven, and early life interventions. WHO steps must evolve from tracking risk to building cardiovascular health for all. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.